Support for Greater Chattanooga is provided by EPB, Blood Assurance, and the local office of UBS Financial Services.
Hi, I'm Bo Wheeler, and I'm a producer here at WTCI. If you're anything like me, what you know about Insure Tennessee has been shaped by things like this.
Black as a symbol of mourning.
Or maybe you heard this.
To stop Obamacare in Tennessee.
Now what we hadn't seen was a thoughtful explanation of the plan. What's the need? What did the governor propose? Why did it fail? And what's next? We decided to talk to some of the key players to get to the bottom of what Insure Tennessee was all about. But first, let me introduce you to Kenny Wilburn.
I started picking cotton when I was 5 years old. We was raised up poor, no water, no electricity, no way out in the country. When I was 18, I got my first tax-paying job, and I paid in income tax and Social Security throughout my whole life. I draw $352 a month, state disability. We don't live rich, but we get by. If somebody's never been in this situation or lived below poverty level, they would not understand how we live. You know, we're in a rural area. There's not no jobs really here in Pikeville. Welcome to the Lee Station Baptist Church House of Hope. Our mission here is to help someone. I decided that family of three, I'm gonna get the food together and take it out to them so they don't have to. We'll sack them up, enough food to them 2 or 3 days. Here's one of our guest rooms. It's mainly for a child. It's really something that I didn't think when I was on drugs years ago that I would ever foresee in my life, a serving like this right here.
So you're talking about individuals between 19 and 64 years of age that make less than roughly $16,000 a year, which equates to roughly $8 an hour. That population is in what we call a coverage gap. They're actually too poor to get assistance with coverage from the government.
This is the landscaper who hurts his leg halfway through the year and is unable to continue to get a full-time paycheck. Right, these are people often in transition.
In 2012, the Supreme Court ruled that states had the option of expanding health benefits to folks earning less than 138% of poverty. But there were parts of the Affordable Care Act that Governor Haslam disagreed with. So he put together a task force. Their job was to come up with a compromise that met the approval of the governor and the head of the Department of Health and Human Services. And they did it. They came up with 2 options for coverage. The volunteer plan would issue vouchers to people who had access to but still couldn't afford employer-sponsored health insurance. The second idea was to create something called the Healthy Incentives Program. Since this plan added some premiums for members who make more than $11,000 a year, that's 100% of poverty. The plan worked in ways to help with those costs. The task force put together the Healthy Incentives Account, sort of like a health savings account. If participants went to the doctor for a physical, they got a little added to their Healthy Incentives account. If they used the emergency room only for emergencies, it meant another addition to the account. And that account could be used to pay down premiums and co-pays.
Well, my first impression of the plan was probably like the first impression that most people in the legislature's impression was, and that is that, well, that's really great if there's a way to do that, but I really need more information.
I thought it sounded pretty good. He had a great idea, but it wasn't detailed out enough for everybody. And that's where the rub started coming.
The governor's plan garnered the support of many different sectors of Tennessee business.
This plan is pretty popular in the state, definitely popular with the business community. The medical community is hugely in favor of this plan because it helps reduce the burden that they pay for indigent care.
But ultimately, the decisions on its success were up to the legislators of the 109th General Assembly.
So the first time it was brought up in the committee, it was voted down in a 7-4 vote pretty decisively. So it was essentially dead until some Democratic-led efforts to sort of retool the bill. They brought that refurbished bill back through 4 more committees where it eventually reached the Senate Commerce Committee where it was voted down 6-2.
2 members vote aye, 6 members vote no, 1 passes. Thank you, Senator Overby. All right, members. Thank you, Chairman.
Myself, I feel that we've been deserted, by the state, and let down.
That's racist.
Kenny and about 280,000 other Tennesseans were counting on the General Assembly to pass the governor's plan for health care. After working for decades in pipe fitting, Kenny took a job at Taft Youth Center in the maintenance department.
Yes, my right shoulder up. I had a complete tear of my rotor cup. I had 4 bone spurs and several torn ligaments. They radioed me to come back to the prison and bring all my tools, and I knew what was going on. And he said, I can't use you if you're not 100%. I can't pick up my 3-year-old granddaughter and hold her for very long because it hurts my back and shoulders. But it's like you lost your manhood.
So what happened? How did such a popular idea fail? Well, it turns out the answer is really not that simple.
What became issues with me was the governor and his task force continually said this is not going to cost the state of Tennessee a dime. A fiscal note came out and said it's going to cost the state of Tennessee an extra $15 million just in the first couple years. That came out of left field. The hospitals in years 3 and 4 were going to make up the difference when the Affordable Care Act would quit paying 100% of it. I said, that's great. What guarantees do we have? We've got a wink and a nod. What written guarantees do you have from the hospital groups that they will actually honor their pledge? There was none.
I think the current federal administration is unpopular, and I think that there's a suspicion to federal dollars.
Yeah, in Tennessee, mentioning the word Obamacare is like political kryptonite. It's so hard for many people to parse out the nuances once you draw that connection so strongly.
Many members justifiably do not trust the federal government, and I understand that. We can, however, trust the word and written commitment of our governor.
Tennessee gets a significant amount of federal funds in a wide variety of programs. So at some level, you have to trust the federal government.
Obama will be gone in 2 years. He's not an issue. That's not an issue.
As we pointed out, if we wanted to do, the ACA or Obamacare, it wouldn't have taken us 24 months of negotiation. We just signed a piece of paper and we're done.
I think it really is a sign of the times that no Republican lawmaker wants to run the risk of being associated with Obamacare.
Just the fact that the funding, or at least a large portion of the funding, was coming through that vehicle just created concern.
We're the first state to have a GOP governor-sponsored plan be shot down by the legislature. No matter how much you do, no matter how much you try to make it not related to the Affordable Care Act, it still comes down to this principle for many people that the Affordable Care Act is wrong and dangerous.
So where does the state go from here? What does the future look like for the 280,000 uninsured Tennesseans who are looking for help?
It's an embarrassing thing when people are in need. It's an embarrassing thing to ask for help. There aren't heroes and bad guys here. It's a complicated issue. We need to find some common ground and find the way to do the thing that's the best for the most people in our state in a way that doesn't bust the budget.
I'd like to believe if we collectively do a better job of educating why we all support this program, that it could make a difference next time.
The governor needs to do what was suggested to him early on back in January. He needs to go back to the federal government. He needs to get better concessions for the state of Tennessee. He needs to get an ironclad agreement with the hospitals to where they can't welch on us. And he needs to come up with a definite plan, a matrix of what he's going to do to exit the plan or stay in the plan.
I'm the type of person that likes, at the end of the day, to look back and see what I've done, and I've done something. I feel good about something. I've fixed something, I've helped somebody. And I was hoping that the people in Nashville would vote this Insure Tennessee in where they could go home every night and their wife or husband say, how did your day go? Well, we passed the Insure Tennessee bill, and we helped a lot of people, and I feel good about it.
If you enjoyed this episode and you want to see more of this series, subscribe on YouTube to be notified when new stories are available. Thanks.